Hello everyone. I'm going to present about my expert system I have developed for mental health assessment and support. So I am Janith Prabhanuka, AI researcher and software developer. So I'm going to talk about these contents: introduction to expert systems, overview of mental health assessment, and tool I have used, and implementation, and the demonstration. Okay, what's the expert system? Actually, an expert system is a computer program designed to simulate the decision making abilities of a human expert. That means if we take a human expert in a specific domain, he has some specific knowledge about the field. As an example, we can take a gastroenterologist. So he is expert about the that domain. If we take a psychiatric, he's a expert in he's an expert in that domain. So he knows about the mental health disorders and the treatments, then everything. Okay. Then actually expert system is using a knowledge base of human expertise, and the there is an inference engine to solve complex problems that typically require human intelligence, which takes the knowledge from human intelligence at its core. So, if we are considering about key components uh, of expert system, we can identify knowledge base, inference engine, and user interface. Knowledge base means contains domain specific knowledge, facts, and rules. So then inference engine process the knowledge base to derive conclusions or solutions. Then user interface is there, allows users to interact with the system. Examples for expert systems are Dendral, used in chemical analysis, and Mycin, medical diagnosis. These are the previous expert systems used in the world and developed in early uh, days. Okay. If we are considering about my expert system, overview of mental health assessment need to be done. So actually, I have faced these challenges and I have researched about these challenges. Mental health issues are often underdiagnosed and undertreated. So we have to uh, take the support of mental health profession. So traditional mental health assessment rely heavily on self-reporting and clinical interviews, which can be subjective. So we can introduce the role of technology here. Technology can play a crucial role in addressing these challenges by providing tools for early detection and continuous support. So digital platforms can offer accessible, scalable, and standardized mental health assessment. So we can consider the components of mental health assessment: symptom checkers, mood and behavior tracking, personalized recommendation. So when considering about symptom checkers, there are some tools to identify potential mental health issues, and they can generate reports uh, about the symptoms. Then mood and behavior tracking, continuous monitoring of mood and behavior to detect patterns and changes over time. So personalized recommendation means personally, individually, it can recommend the treatment patterns, not only treatment patterns, and that is about the lifestyle changes should be likewise. Okay. Uh, this is an introduction to my mental health expert system. Objective was build an intelligent system, provide initial mental health assessment, mood and behavior tracking, personalized intervention, recommendation, aiming to improve access to the mental health care. So, features I have considered: symptom checkers and initial diagnostic tools so that evaluate mental health symptoms and provide initial diagnosis. then support by recommendations. Actually, these people have helped me to develop this system. Medical guidance given by my colleague, Dr. Chintaka Madhushankar Sampath, holding MBBS, and Dr. Imasha Adavatta, holding Bachelor of Ayurvedic Medicine and Surgery. Then developed by me. Okay, when we considering about the knowledge base of this expert system, we have used ICD-10 criteria. So ICD-10 is a document, the International Classification of Diseases, 10th revision, developed by World Health Organization. It's a globally recognized system used for diagnosing and classifying mental and behavioral disorders, providing standardized codes and criteria of mental health condition. So why did we use ICD-10? Because it's a standard document and accurate, and consistency with the consistency means the facilitate uniform data collection. So that's an international guidance given for mental health disease, mental health or mental health problems or disorders identification. Then, in addition to that, uh, guidance given by this book, Handbook of Clinical Psychiatry, by Professor Ravin Hangella, and I have attached both books here. So if we have go through about this document, I can show you. Okay, see, this is the ICD-10 document, and there are categorized mental disorders are there. So according to this, we can check the symptoms and we can give them to marks. And according to that, we can analyze the what's the disease, and we can generate what's the disease, and we can suppose what to do, and the solutions for the issue, and recommendations to treat. Okay, if we as an example, we can consider alcohol dependency. So no, we can consider bipolar affective disorder. So everything related to bipolar affective disorder identified in this document. So finally, they are able to give solutions also. By referring this document, I have taken the knowledge for my expert system, and this is the book of clinical psychiatry by Professor Ravin Hangalla. I also followed this document, and he's categorized the basic mental health disorders, and he's in some sections he he was supposed the questions also. So I have taken some questions from this and taken guidance from this book. And uh, as an example, uh, let's take you can see treatments are also there, but we can't consider about the treatments because I will tell the reason in future. As an example, I'm tell about the alcohol dependency. Okay, this is about alcohol dependency. So if you are addicted to alcohol, you can identify the symptoms and everything from this document. As an example, I'm taking this, and if I go through features of alcohol dependency also there, and withdrawal of symptoms. Uh, this is the question I have told about that diagnostic guidance guidelines. So actually, the medical experts was sorted out this and uh, suggest me to prepare the questionnaire. The management plans also, they are actually, this is not relevant to us because this is a part for doctors. These are the treatment patterns they have given. This is the medication plans they have supposed. Actually, this is definitely able to do by a doctor. We can't engage that. Okay. Uh, Actually, I demonstrated it as an example. So we are going to the slide that we have talking about. Okay, the knowledge base. Okay, we were here. Benefits of using ICD-10. Actually, that is a globally recognized documentation. So we can use it for our diagnosis. Okay. Then components of knowledge base. Diagnostic criteria are there. Symptoms are there. Codes for each mental health disorder, and treatment guidelines was there as I shown you. Okay, this is the tool we have used to build the expert system. Actually, expert system also can be built by the uh, normal software developing methods, but already there are so many tools developed to easily develop expert system. One example is VisiRule, previously called as Flex. Then the another one was there, ES Builder. Likewise, there are so many tools there. So we are using tools to easy get easier our life now. So if we if we don't have to trouble in writing codes, then likewise, if already tools are exist, if uh, if anyone can using if anyone can develop a system using a tool, so that makes their life easy. So let's use easy ways. That's the engineering, applying the engineering principles for real world problems in the easiest manner is the engineering according to my point of view. So let's go. Uh, in this visit rule has some specific features. Uh, we can create the chart. Actually, flow chart is there. So then we can explore the knowledge and we can validate the result and we can deliver the outcome. Okay. These are some features of visit rule and my expert system. Low code, no code. We don't need to code here. We only have to draw the diagram related with the flow chart. Then programming via flow chart. If we need programming, they also facilitate that. Then user-friendly user interface, multi-layer toolset, and generation engine. If we need to take the output, I will show you next. We can take text, PDF, XML, or HTML. Actually, I have generated the HTML file and easily able to share with the audience. Okay, reasoning is there. How this is happened, what is this, and why that was happened. Reasoning techniques are also there. Conclusion derived by user answers and visual explanations are there. Automated testing and regression testing. Examine knowledge truth table generator also there. Okay, let's consider about implementation of our system. The methodology is allow user to tick the symptoms. Then, according to answers, system able to diagnose the disorder guided by ICD-10 and Professor Arvind Hangel's book. Then suggest to meet a psychiatric or psychologist, or it suggests lifestyle changes. If can't, he is given national mental hospitals contact number 1926. Likewise, there are some suggestions there. So implementation stage 2 is still under construction. Suggest treatment guidelines or references. That is so difficult because medication is unique according to person. So we can't give medication. Uh, Even doctor can't give a medication plan for common aspect. So that is where that must be very careful because personalized medicine need to be implemented. So in next stages, we will try to implement that. Okay. As an example, we have taken the depression. Then ICD-10 code was F32. Diagnostic criteria, there are criterias I have shown you, and symptoms are there. Treatment guidelines is there. Okay, let's go to the demonstration of the mental health assessment. This is the diagram I have shown you, built by the this rule. So here, actually, I can demonstrate on. I have only demonstrated three diseases there because if flowchart is complex, you can't understand. So that's why I simplified there. I have given OCD and depression, schizophrenia, and bipolar AD. So these are the diagnostic criteria relevant to each diseases. So let's go. This is the example for my expert system. That name is Psyhealth. Uh, so I will demonstrate you. Actually, I have selected here alcohol dependency and asking questions and finally generating the results. So this is brief introduction to my Psyhealth version 1.0 expert system developed to analyze mental health disorders before meter psychiatric and understanding uh, symptoms and uh, evaluation given by the system. So in here, it can be identified the disorders: alcohol dependency, obsessive compulsive disorder, depression, schizophrenia, and bipolar affective disorder. If we are able to try this, okay, this is for the link. I'll show you. I have locally downloaded. This is the expert system I told you. Uh, Psyhealth version 1.0. So we can run this. Okay. First, we have to select a disease from uh, these five diseases. So, if you are suspecting you are suffering from depression, you can select that. Then you are suspecting from alcohol dependency, you can select it. You can select this, and you can select OCD if you are suspecting you have this. As a demonstration, let's take alcohol dependency. So it says now I am going to ask you some questions about your alcoholic beverages during the past year. Okay. If you are okay to go, then click OK. Then how often do you have a drink contains alcohol? It determines the frequency of alcohol beverage of yours. So if we take more than four, actually this should be there's a text more than four a week. This should be okay. Do you really feel you are addicted and really need to break the addiction? Yes. Do you drink with colleagues after work? Yes. Then it shows the suggestions. Leave the workplace immediately after work. Avoid areas when colleagues consume alcohol. Let's consider another explanation. Let's take depression. Okay. This is asking questions. Feelings of worthlessness and excessive guilt. If you feel guilt, please guilt. Then fatigue or loss of energy. Yes. Significant weight loss is there. Yes. Do you feel loss of interest and enjoyment never had before? Highly. If you give highly, you have a risk for moderate depression level. Change your lifestyle and daily routine. Please meet a counselor. If you select no, please change your lifestyle. Meet a physician. If you are suffering from another uh, disease like diabetes, control likewise, so you can take a full blood checkup. So if you take yes, uh, did you have disturbed sleep? There are so many questions. Okay, yes. There, I again click about yes. Please change your lifestyle, a physician, and uh, do a full body checkup. So, uh, when you are considering about OCD, that's also like that. Urge and then yes. Okay. Uh, Likewise, you can test the disease if you are suspecting you are having. So let's go to the presentation. Uh, so that's it. Thank you very much for listening and wish you all the best and keep touch with the AI aspects of healthcare. I am updating. Thank you very much.